Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. The stimuli affecting the vasopressin secretion. So let's look at what will decrease the secretion. So decrease secretion is by alcohol or by increase in ECF. Then comes the decrease effective osmotic pressure of the plasma. So decrease in the osmotic pressure of the plasma. Now let's look at what increases the vasopressin secretion. So increase in vasopressin secretion, it may be brought by the increased effective osmotic pressure of the plasma. Increased pressure, that is the what pressure? The osmotic pressure of the plasma. Then there is also decrease. The decrease in what? The decrease in the ECF volume. Next is the pain, emotion and stress and exercise. Then comes the nausea and vomiting and standing, as well as the angiotensin 2. The angiotensin 2, as well as the clofibrate and the carbamazepine. To learn and grow daily like this, please do subscribe.